Welcome to this explainer. Today, we are diving straight into the actual biology of male hair loss, cutting through all that online noise to look at the real science behind the treatments. If you've been going down the internet rabbit hole trying to find answers, you know exactly how overwhelming it can be out there. So, our goal today? To give you a super clear, structured breakdown based directly on clinical literature.
To help you navigate this complex topic without the hype, we're going to structure this explainer into a clear medical journey. We'll start with the root cause, which is DHT. Then we'll compare finasteride and minoxidil, look at the combination approach, go over timelines and expectations, get real about the honest risks and side effects, and finally, look at how modern online treatment actually works.
Let's jump right into Section 1, the root cause, DHT.
First things first, we really need to validate what's literally happening on your scalp right now. If you're noticing a receding hairline or maybe some thinning up at the crown, you're likely dealing with something called androgenetic alopecia. We usually just call this male pattern baldness. And hey, it is incredibly common. It's largely genetic and hormone-driven. So no, you aren't losing your hair because you wore a baseball cap too much or bought the wrong shampoo. This is a progressive biological condition that's hardwired right into your DNA.
The real culprit behind all of this, it's DHT, or dihydrotestosterone. DHT is basically a hormone made from testosterone by an enzyme called 5-alpha reductase. Now, if you are genetically sensitive to DHT, it gradually attacks your hair follicles in a process we call miniaturization. Think of it like this. With every single hair cycle, your hairs grow back just a little bit thinner, shorter, and lighter, until eventually the follicle just throws in the towel and stops producing visible hair completely. This is exactly why treatments work best when you start early while those follicles are still kicking.
Now, we absolutely have to set our expectations in reality right from the jump. The clinical goal of medical intervention is really to pump the brakes, to halt the progression of hair loss, and, maybe wake up some of those miniaturized follicles. But let's be real, it's not some magic wand that's going to guarantee you that completely full head of hair you had back in high school. Individual results are always going to vary based on your specific genetics and just how early you actually get started.
Moving on to Section 2, finasteride versus minoxidil.
Okay, so these two medications are the heavy hitters, but they tackle the problem in completely different ways. Think of finasteride as your defense. It's a 5-alpha reductase inhibitor, meaning it literally blocks the enzyme that creates DHT in the first place. By dropping those DHT levels, it actively slows down that whole miniaturization process we just talked about. Minoxidil, on the flip side, is your offense. Fun fact, it was originally developed as a blood pressure med because it's a vasodilator. It ramps up blood flow right to the follicles, which prolongs the active growth phase called the anagen phase, and that's what encourages thicker, longer hairs to grow.
Both of these meds come in a few different formats, and getting a handle on the nuances here is super important. With finasteride, the standard daily 1 mg oral tablet is FDA approved, and it lowers DHT everywhere in your body. There's also a topical version designed to act more locally on the scalp, though it can still be absorbed into your system. Keep in mind, topical finasteride is usually compounded and isn't an officially FDA-approved formulation. Then for minoxidil, the over-the-counter 2% or 5% topical liquid or foam, that is FDA-approved. But a low-dose oral minoxidil tablet, usually around 1 to 5 milligrams, is actually getting prescribed off-label more and more by providers because it's been shown to be incredibly comparable to the topical version for a lot of guys.
Let's look at Section 3, the combination approach. Since these two drugs do such vastly different things, you don't actually have to pick just one. When you pair finasteride, which lowers the DHT, with minoxidil boosting the blood flow, the combined effect is honestly clinically significant. In a 12-month study of men using a combo of low-dose oral minoxidil and finasteride, a massive 92% of them were stable or improved. And get this, over half of those men showed visible regrowth. Now, combination therapy isn't a silver bullet for absolutely everyone, and a provider has to make that call, but man, those results are incredibly encouraging.
All right, Section 4, timelines and expectations. Grasping the science is only half the battle, right? The other half is totally psychological. Treating hair loss is the ultimate patience game. During the first 1 to 4 weeks, especially if you're just starting minoxidil, you might hit what people call the dread shed. It sounds scary, but it's just a temporary uptick in shedding because the medication is literally pushing out resting hairs to reset your growth cycle. It's totally normal. Honestly, you need at least 3 to 6 months of consistent daily use before you can even think about judging the initial results. And once you hit month 12 and beyond, it's all about long-term maintenance.
Here is the golden rule of this whole thing. Consistency is everything. Period.
Because these drugs are managing an active, ongoing biological process, they literally only work while you are taking them every single day. If you start skipping doses, you're completely undercutting your own results. And if you stop treatment entirely, well, those DHT levels are going to spike right back up, the hair loss kicks back in, and any awesome gains you've made are usually lost within just a few months.
Which brings us to Section 5, Honest Risks and Side Effects. Being totally straight with you matters way more to us than a sales pitch, so we need to objectively look at the real clinical risks here. Let's start with finasteride. In clinical trials, sexual side effects, like a dip in libido or erectile difficulty, happen in roughly 3.8% of users, compared to 2.1% of guys who just took a placebo. While that's fairly uncommon and mostly reversible once you stop, some men do report persistent symptoms even after quitting. This is known as post-finasteride syndrome, or PFS. It can include ongoing sexual, mood, or cognitive issues. It's taken very seriously in the medical community and is currently under active research. Also, just a heads up, in 2025 the FDA put out a specific safety alert about compounded topical finasteride because of reports of erectile dysfunction, brain fog, and depression. So it is absolutely vital to discuss these things openly with your provider.
Minoxidil definitely carries its own set of risks, too. The topical stuff can sometimes cause scalp irritation, dryness, or even unwanted facial hair if the liquid drips or spreads. Low-dose oral minoxidil, on the other hand, can cause hypertrichosis, which is a fancy word for increased body hair, and it requires a provider's oversight because of potential cardiovascular effects, like fluid retention or faster heartbeat. And I need to give you a very critical safety warning here. Finasteride is absolutely 100% not for use by women who are or may become pregnant. It carries a risk of severe birth defects, and honestly, the tablet shouldn't even be handled by pregnant women.
Finally, Section 6, How Online Treatment Works.
So if you're comfortable with the science, the timelines, and the risks, how do you actually go about getting a safe medical evaluation? Well, provider-led telehealth has made this whole thing so much easier. These platforms basically follow a simple 5-step path. First, you do a secure online intake, sharing your medical history and snapping a few photos. Second, a licensed U.S. provider reviews everything to make sure these treatments are actually safe and medically appropriate for your specific physiology. Third, if you're a good candidate, they write up a personalized plan. Fourth, the medications get fulfilled by licensed U.S. pharmacies and shipped straight to your door. And finally, step 5, you follow up with your provider down the line to tweak the protocol if you need to.
Providers on platforms like Orenwell make this whole journey incredibly accessible because they connect you directly with licensed professionals who evaluate your specific eligibility. You can get your hands on these evidence-based treatments with super transparent pricing, starting right at $124 a month. It completely takes the guesswork out of the equation. You're finally relying on hard clinical data instead of just hoping for the best with some unproven over-the-counter shampoo.
We have covered a lot today. We talked about the biological root cause of DHT, how finasteride and minoxidil team up to fight it, the stark reality of the timeline, and the very real medical risks you have to weigh. The clinical science is undeniably proven, and the path forward through telehealth is right there. But that leaves us with one final big question. Are you just looking for a quick overnight fix? Or are you truly ready to make the daily long-term commitment required to protect and restore your hair? The science is ready whenever you are, but the patience, that's got to come from you.